Welcome, and thank you to the EUFMD for the opportunity to share this short summary of the historical and ongoing work being done by the California Department of Food and Agriculture on foot and mouth disease vaccination contingency planning. My name is Pam Hullinger, and I'm a veterinary epidemiologist currently working for the EUFMD. My co-presenter, Lisa Quiros, leads the Emergency Preparedness and Response section of the Animal Health Branch at the California Department of Food and Agriculture. We are co-presenting as I was a collaborator in the early aspects of this work. We hope you find this presentation helpful in the context of your foot and mouth disease planning efforts. While we can't join you in real time for questions, we'd be happy to follow up via the meeting's chat feature. The goal of an emergency foot and mouth disease vaccination campaign is to suppress virus replication in the high-risk animals by rapidly being able to vaccinate a high proportion of the at-risk population. In California, the selected vaccination strategy and the disposition of vaccinates will depend upon the nature of the outbreak and the population at risk. California is a large state with a diverse livestock population. One of the greatest concerns is introduction of foot and mouth disease into the dairy-dense region of the California Central Valley. Disposition of vaccinates may include euthanasia and disposal, slaughter for consumption, or living out productive lives, or any combination of these options. While the USDA ultimately controls access to foot and mouth disease vaccine in the United States, the state, in coordination with USDA, is responsible for identifying the most optimal vaccine strategy and providing operational support to execute the vaccination campaign. California's early planning efforts were inspired by the successful use of responsive foot and mouth disease vaccination in Uruguay's national cattle herd in 2001. This vaccinate to live approach was successful in controlling the outbreak with minimal slaughter, utilizing 2 rounds of vaccination for the nation's cattle herd of just over 11 million head. So in 2010, in collaboration with Uruguay's Ministry of Agriculture, California learned valuable lessons about procurement, product testing, approach to vaccination distribution, cold chain maintenance, and the use of industry vaccinators with government oversight and monitoring. In particular, the animal identification system and movement tracking database in Uruguay were quite impressive. California has seen the need to devote time and resources to foot and mouth disease vaccination planning for several reasons. First, if an outbreak were to occur in the dairy-dense region of the state, the outbreak would have likely spread before detection due to the nature of animal and product movement in this highly concentrated area. Additionally, for dairies, indemnity is costly and the public tolerance for large-scale depopulation would be very low. The logistical challenges and environmental impacts of large-scale disposal are significant and present increased biosecurity risk in the face of limited rendering capacity. Planning efforts started back in 2010 and have included an exercise focused on receiving and redistributing the USDA National Veterinary Stockpile assets, the utilization of private veterinarians in vaccination delivery, foot and mouth disease controlled movement workshops, and most recently a full functional national exercise that explored bulk milk tank screening for foot and mouth disease along with requesting Fmd vaccine from the USDA. And now it is my pleasure to turn the talk over to my colleague Lisa Quiros, who will discuss in more detail California's planning considerations for foot and mouth disease vaccination.
Because vaccine will be manufactured to match our outbreak, we know there will be a delay between when we request vaccine from USDA and when the vaccine arrives in our state. If we believe there is a credible threat and we will use vaccine at all, it is important that we request vaccine early on, maybe even before there is an actual detection in our state. We've talked about triggers for requesting vaccine, such as detection in North America. So how do we know how much vaccine to request? Our state has a good estimate of animal populations based on several available data sets, but in order to know how much vaccine to distribute to each farm, more specific data will be needed. The USDA has developed a herd plan template that can be used to collect this farm-specific data. Our plan is to capture this information while we are waiting for vaccine to be delivered to our state. During this time, we will contact individual producers, have them sign the herd plan and agreement to vaccinate, and update and validate head counts on each premises. It's important to ensure long-term strategy planning along with immediate response. Someone needs to plan for what will be required to regain freedom from disease status from the very beginning. Once the vaccine is requested, if staffing is limited, many of our responders may be busy with other critical response activities. It may be necessary to assemble a group of scientists and subject matter experts to study the California situation and make recommendations on the vaccination strategy, prioritizing premises for vaccination, and establishing a plan for how to use vaccine effectively should we not receive the amount we requested. We began our planning with developing standard operating procedures, focusing on 3 areas: vaccine handling, which includes receiving, storing, distribution, and chain of custody; vaccine cold chain, so how do we ensure the cold chain all the way out to the farm premises; and documentation. We asked ourselves several questions. What will be required in the form of animal ID? What other documentation might be needed? How long will the documentation be necessary? Depending on the vaccination strategy, we anticipate it may be necessary to track vaccinates throughout their useful life. We also asked how might we get real-time updates of vaccinated premises to our incident command so that they can be kept informed. Other considerations include vaccine security. So we anticipate needing to coordinate with our state emergency management agency to get security teams to escort vaccine shipments to the state warehouse. We also anticipate needing security at the vaccine distribution site itself. So we plan to use a third-party logistics provider for our state vaccine warehouse. We plan to station at least one state logistics person in the warehouse to oversee operations and be the liaison between the warehouse and the incident command post. In 2011, we exercised our ability to distribute vaccine during a simulated FMD outbreak. We had state personnel in a cold storage warehouse repacking vaccine for individual premises. What we found is that government teams are not very good at this. The more effective way is to contract with a third-party provider that distributes vaccines as part of their normal business operations. They are already set up for the cold chain, inventory, and shipping, and they are way more effective at this process and will increase the speed and accuracy with which we can store and distribute vaccine. In California, we use the Incident Command System to manage outbreaks of foreign animal disease. The Incident Command System helps provide an ad hoc organization needed to manage the outbreak and helps to reduce duplication of efforts and standardize processes. We have a state incident management team that includes blended resources from CDFA and USDA veterinary services. USDA also has national incident management teams that can deploy for a foreign animal disease outbreak. In California, we manage outbreaks in Unified Command with USDA counterparts, so it's helpful that we use the same Incident Command System training and organization so that we can blend together quickly when needed. We recognize the need to support different distribution strategies for vaccine. In this slide, it depicts several different organizational options, which include government vaccination teams, vaccination teams that are made up of on-farm personnel that can be led by private practitioners or other temporary employees. In reality, we believe it will take a combination of these resources and many others to get this enormous job done in a short period of time. Our concept also includes an on-site validator. This would be a person from our incident command post who is assigned to each premises to oversee the vaccination and report back the status to the incident command post. In this way, all vaccinations would be overseen by a government official. Since vaccination is just one of many other disease outbreak critical activities that will be occurring simultaneously, we anticipate that we will need to engage other state and federal agencies to supplement our personnel resources. So what are our next steps? We need to update our standard operating procedures. We will be educating and training producers and responders on our plan. We plan to conduct an exercise to test individuals' capabilities to execute what they learned through training. And we need to test our coordination with the laboratory for broad FMD detection and surveillance. We want to look at capacity reporting and data monitoring. Thank you very much for your attention to this presentation. Please remember to leave questions in the chat, and Dr. Hollinger and I will do our best to get answers for you.